Hi, I'm Dr. John Bull, and welcome to the John Bull Center for Cosmetic Surgery. Today, I have a patient here that is interested in facial rejuvenation but did not want to undergo a facelift with downtime associated with it, so we discussed other options and settled on doing what's called the Instalift, which is going to give her a great result. Her main complaint was this dropping of the jowls here and augmenting a little volume in the mid-face. So I pre-marked the placement of the Instalift sutures, which are barbed or coned sutures that we're going to place under the skin so they're not visible, that will help elevate your tissue and stimulate your own body to form collagen to help hold the facial tissues in the higher, more elevated position. All right, so to do that, we'll make a needle stick here, right along the bottom of the jawline, here and here. These 4 spots are the entry points where I will put the sutures through this direction, and they will all exit in this general area here. And by doing that, that allows me to elevate this tissue and anchor this tissue here in a higher position. I'm going to show you that in just a minute. So you had asked a question about what the sutures are actually made out of. They're made out of a combination of PLLA and PLA, which both dissolve over time but stimulate your own body to create collagen, which will help hold this even longer than the sutures. All right, I like to let that sit for a second because it helps keep the skin open just a little bit. Then I'm going to pass this just a second. So you can see that there are little cones on the string. I'm not sure if you can see that on the video, but there are little knots tied as well. I'm going to tighten the knots and then place the suture. I want one in here. Let me pull that out for a second. And then I'm going to go right in to that's right below.
Do you want her to turn her head for you?
Turn just a little bit.
Sure. Yeah. You can add it there, I think.
And this part should be relatively pain-free if we're in the correct plane. Now, a trick that I like to use is to push this here and that cone come out right there, the needle come out right there. And I'm going to pull the skin back, let that sit for a second. Pull this here. You can pull the cones in. There.
And if I could just say, this is pain-free. You don't feel a thing.
And then I'm going to put another one. Same incision, right down to that little black line. And then back it up this way. And if you do feel it, most people will let me know, but as I'm inching it forward, making sure we're in the right space. Okay, pause that. A little resistance on this one. And then it's in. I know it feels, you hear it, making all sorts of noise. So we're going to anchor these by elevating the tissue up, and we're going to do it again a second time when she's sitting in an upright position. You can actually see the pull of the tissue when I do that. Same thing there. And there. And now we've got extras, it's all kind of been lifted. Got a little bit of a dimple right there, but I'm going to work on that in a minute. Now I'm going to anchor these and then go to the other side. I'm going to pull this direction and then anchor. Alright, I'm going to do the same thing. I'm going to pull on this side. click, getting just a little bit higher, which is where I want to match that side. Of course, no two cheeks are identical. That's water, nothing else. I'm using that to just glide over your skin. Good. I'm going to anchor this side. What we have done is just cut all the excess suture off and put a little bastration ointment on. Today's the only day you really have to do that, but we do caution people to try not to smile too much, no dental work for the next 3 weeks. Try not to do a lot of facial animation or stretch your mouth open very widely for the first week, and this will set up and you won't have to worry about it anymore. No facials for at least 3 weeks, and we don't want you laying on your face for 3 weeks so that these set in place the way we like it. She does have a couple of little pucker spots, but that's from the numbing medicine. As that swelling goes down, that's going to be perfectly in line with the rest of her cheek. Thank you for watching.